Hi, my name is Mary Stevens Blaine, and I wanted to talk today about my professional paper that I wrote um, on the Institute of Medicine's recommendations. And I chose the recommendation for nursing residency programs. Um, why nursing residency programs should be a priority for the future of nursing. So, a couple of facts that I researched: the nursing shortage is continuing to increase as our baby boomer generation ages, and they retire, and we need more nurses to replace them, which is leaving the hospital short-staffed. Nurse graduates are also at an all-time high, but hospitals can be wary to um, hire them because of the high cost to train them. In a survey done by two authors of one of the articles that I read, it stated that a large percentage of nurse managers believe that new graduate nurses were not adequately prepared. Um, so inadequate training can lead to burnout, frustration, and poor patient outcomes, which can result in high new graduate turnover. Nurse turnover is an expensive issue within the healthcare systems. When turnover is high and units become short-staffed, the unit needs to hire contractor travel nurses, which is very pricey. The recommendation of a nurse residency program as an accredited standard for all nurses to complete upon graduating could give nurses a kind of baseline foundation of how to act or how to be a nurse when they start working independently on their own. This was a graph that I liked. In the middle, it has my residency and the things that should include in there for nurses. So your clinical skills, you're learning all your clinical skills, which you learned a lot in nursing school and might have done in a couple clinicals, but you haven't done in a long time, or maybe you never got to do them in clinical. So you're learning all your skills. You're getting comfortable with those skills. Um, your assessment skills, IV sticks, anything, medications. But then also your social interaction. You're learning how to interact with other members of the healthcare team in order to provide the best patient outcomes possible. Next, you're going to have professional growth and development. So obviously, as you get experience and are working as a nurse with your preceptor or in your residency, you're going to grow professionally, and you're going to learn the ins and outs of being a nurse and what is expected of you on a day-to-day basis, as opposed to sometimes when you're in clinicals, you're only there for 4 hours and you really miss the day-to-day interactions and how to balance all the different tasks you're given. Why I think they're a great idea. Transitioning from a student to a nurse can be very stressful. As I just said, you don't get the full experience of nursing in clinicals. Um, you get a very one-sided, excited view of what you think it is, but you don't get to deal with as many of the issues that you would deal with actually working as a nurse. Um, Turnover in the first year of nursing ranges from 20 to 40%, which is pretty high. That kind of accounts for nurses leaving their first job or leaving the profession altogether. They're recommended by the Joint Commission just because, they give nurses that training that they need. It promotes safety. It can lead to better patient outcomes when your nurse is trained and competent and knows how to keep her patients safe, as opposed to a nurse who's thrown into a situation before she's ready, which can lead to poor patient outcomes and can leave our patients unsafe. Nursing residency programs promote nursing skills and experience, as well as critical thinking skills, clinical judgment, and communication and safety. Doctors have to complete a residency program in order for them to practice independently. Nurses should have a similar program. While it doesn't need to be, a 3-year program like physicians, a 6-month, 3 to 6 month program for a new graduate nurse um, really should be a standard in order to um, have a competent, safe, knowledgeable nurse on your staff. Barriers to this are going to be funding and the expense of it. How expensive it is to train our new graduate nurses and ensure they're getting the best training possible to make them be the best nurse possible. And also funding from maybe a wealthier large hospital could probably afford to do this, as opposed to small rural hospitals might not be able to afford it, which then, that's where government assistance comes in. The Institute of Medicine article actually recommended that Medicare and Medicaid and other government services help pay for developing these programs and developing a standard in order to, train and for us to have the best nurses possible. Um, the best solution to these barriers that I found would be to educate the hospitals and promote these programs and talk about the benefits. Um, you know, while new graduate nurses are an investment and they are expensive, but they are an investment, we must treat them as such and give them the training that they need in order to prevent burnout and turnover. Um, if they feel appreciated, if they feel like they're getting everything they need, they're getting the training they need, they have all the resources, and they know how to utilize them, um, then that can help prevent burnout, which can then help prevent turnover, which can then lead into the need to hire contract nurses. A nursing residency program at Methodist Hospital found that nurses who completed their program had a higher retention rate after the first year as opposed to others. Methodist Hospital, before they had it, their retention rate of holding on to their new nurses was about 50%. So that means half of them either left the profession, left their hospital, left the unit they were trained on, etc. As opposed to after they began and implemented their residency program, they had an 89% retention rate, which meant that they were able to hold on to 89% of their nurses. They felt like they were getting the training that they needed, and they didn't feel that burnout. They didn't feel kind of like the deer in headlights look. They felt um, like they were able to be the best nurses they can be and give safe, competent care. Um, while a lot of the other ideas by the Institute of Medicine were great and a great idea for nursing's future, I believe that this is the most important, because nursing has no future without new graduate nurses. We're always training new nurses, and we might as well have the best program possible nationwide in order to have the best nurses possible. Um, the residency program should eventually become a standard so that all nurses who graduate can complete this program, get the training they need, and become safe and competent nurses. Thank you.